Good girl. Good girl.
That's enough.
Yeah. I can't remember.
Yeah.
Yeah, you've got PE. And then Mummy will come and pick you up today. Yeah? Is that nice? So what are you doing at school today?
Some writing and some playing.
And some playing, and you're going to play with your friends. Yeah. Since 2007, I've lost 5 babies, all quite early and within the first trimester, with bleeding, and each one of those ending up in hospital having to have surgical management. We were lucky enough to have Mollie in 2014, but that was no means an easy ride.
I want to play on that.
I think you're a bit big for that one. Yeah. What are you getting now? Oh, Mollie's makeup.
And I've got
So
my
nice.
light.
I'm not playing with makeup though.
No.
No. That's Mollie.
Well, I'm going to look.
Yeah. Who's this?
Dexter.
So that's Dexter when he was very first born. Singing. Yeah.
Yeah, and this is Dexter and me.
And you. Do you want to show Dexter Sally? See if he'll stay still.
Dex.
It was tough, and I'm quite a tough person. I take things in my stride. But it was very hard for myself and my husband. I think what made it harder was once Mollie was born, having a child already and then suffering a miscarriage after Mollie, it was heart-wrenching to know that I might not ever be able to give her a sibling. And also being pregnant and not knowing what to tell your child, because you know you're probably going to lose the baby that you're carrying.
So a while ago we discovered that at the time of implantation there are specialist cells that will surround the embryo, and those cells will serve as biosensors, meaning that they are programmed to either eliminate poor quality embryos or actively support their further development. And we have found that these cells were defective in patients who have multiple miscarriages, and that was caused by loss of stem cells in the lining of the womb. So this trial was designed to test if we could use a drug to boost the amount of stem cells in the lining of the womb and improve the quality of the lining at the time of implantation. The trial was not designed to actually measure a reduction in miscarriages, although women who were treated with sitagliptin, with the drug, actually did very, very well in their next pregnancy. So the trial was solely designed to see whether we could elicit the biological effect that we were after. And of course the next step now is to do a large-scale clinical trial to see how effective it actually is in preventing future miscarriages in these patients.
So we now can increase the stem cells, and the next step is to find out whether or not it actually ends in more birth. Obviously, all the women in the trial did go on and try and have babies, and in fact, in the people who took the sitagliptin, there were 3 miscarriages, but in the people who took the placebo, there were 6 miscarriages. So that shows a possible prevention of miscarriage, but obviously with very small numbers, we're not sure. More complicatedly, 9 women had babies in the sitagliptin group, but in fact 7 women also had babies just on the placebo. So with that data, we can't possibly say yet whether sitagliptin really increases your chance of having a baby, and to know that information we'd have to recruit hundreds of women, not just tens of women.
You do mummies. Oh. Finally started to relax around 30 weeks. And he was born at 37 weeks, nice and healthy.